Hi, I'm Dr. Rudy Cashman, neurosurgeon for Indiana for 40 years, but I'm only 39 years old. I'd like to speak to you a little bit today about proper eating. Not really dieting. I'm not for diets, but I'm proper eating. Being a neurosurgeon, I treat a great deal of vascular disease, patients with strokes. I've seen many patients with heart attacks, with diabetes. Probably 2 out of 3 patients that I see in my office, I personally think, they need a coach. They need a coach. They don't need me to do anything fancy. So I took a great interest in the mind and the body. I've developed a mind-body index to my left and your right. Diseases caused by the mind, totally or partially. Then I took a great interest in the diet. I have a book coming out shortly, within a few weeks actually, called The Secret of the Non-Diet. In other words, not dieting, it's about eating the correct food. Within 3 months, I'll have one coming out for children. Here's the cover on the adult book. It has a painting on the cover done by me, Shem, an artist, in an art gallery that I own. And I will have one coming out for children shortly also. So let's get on this road to learning something about the proper foods to eat. This is really what I'm talking about. I'm not going to be talking about portion control. I don't want you to count calories. I don't want you to drink anything funny. It'll be nothing like that at all. It's proper food selection, and you eat till you're full. You can frankly eat all you want because the food itself will stop you from overeating. So let's start out on this journey. Let's have a little bit of fun here. What are the markers of heart disease? Let's go over these one at a time. Inflammation. It used to be thinking that your elevated cholesterol, high cholesterol, was the best marker of heart disease. Actually, it turns out now it's turning out to be inflammation. Inflammation is measured by CRP in your blood, and you can from that see how high your inflammatory factors are. Fat has a lot of inflammatory factors in it, and we'll be discussing that in more detail. Another marker for heart disease is cholesterol, your cholesterol level. The best cholesterol level, frankly, is 150. The Framingham Heart Study proved, 50 years the study's been going on, if your cholesterol was under 150, you never had a heart attack. Isn't this an unbelievable figure? Yet, I see physicians sometimes accept, 180 to 200 is okay. Don't accept it. Aim for 150. If you did that, you'll never have a heart attack or a stroke. Thirdly, obesity. This is certainly a marker of heart disease. People that are overweight have a body mass index, which is based on your height and your weight. You should know what your body mass index is. It should be 25 or so. If you're 30, you're overweight. 35, you're obese. And if it's 40, you're morbidly obese. You need to know what that is. Why is obesity so important? Because fat produces inflammatory factors that cause heart disease, cancer, Alzheimer's disease, arthritis. So obesity certainly is a marker of heart disease. Diabetes. This is a marker of heart disease because diabetes results in insulin resistance, and insulin resistance produces plaques in the arteries. You close off the arteries and have a heart attack. Diabetics have a much higher rate of vascular disease, strokes. You all know that. They get their extremities amputated, their renal arteries shut down, they need to be dialyzed, they go blind because the arteries develop cholesterol in them. So diabetes is a big marker of heart disease. High blood pressure, we all know, leads to heart disease because the pressure in the arteries produces narrowing of the arteries, growth of the tissues in the arteries, and they narrow the arteries to the brain as well as to the heart and to the kidneys. So hypertension is a big marker. Blood clotting. If your blood clots too easily, then you're more likely to close an artery off. And that's the reason you see people taking aspirin and Plavix.